Given the possible increased transmissibility of new viral variants, it is necessary for us to take tighter measures to mitigate further risk of spread in both our healthcare institutions and in the rest of Singapore. The presence of these viral variants of concern amongst our local cases affirms our strategy to vaccinate all healthcare workers and prioritize vaccination for older Singaporeans. Had we not done so, the Tan Tock Seng cluster would have been significantly larger at this time, and the likelihood of that cluster getting out of control that much greater. This is therefore a reminder to all of us that we should get ourselves vaccinated and protected when our time comes, and we cannot afford to be complacent. I looked at the 40 cases that we had reported in the Tan Tock Seng cluster. 8 cases who had been vaccinated were either asymptomatic or exhibited very mild symptoms, and none required oxygen therapy. Of those not protected by vaccination, 7 of the 20 had need of oxygen therapy, and we are aware that 1 patient unfortunately has passed on. Based on the early phylogenetic information that's available to us, the cluster is due to a viral variant, but the vaccine appears to have done relatively well against it. In those tested and had received the full vaccination, in our testing, they had demonstrated evidence of antibodies to the spike protein, which demonstrates a good response to vaccination. But as Minister has shared, vaccination does not prevent you from getting infected 100%, but it will safeguard you from getting a severe infection, and it provides some protection in limiting further transmission. We're still not out of the woods as far as the Tan Tock Seng cluster is concerned, and we remain vigilant in looking out for more cases amongst patients who remain in the hospital, among the staff at the hospital, and in those who are presently under quarantine. And we can all do our part by being disciplined in our mask wearing and adherence to safe distancing measures.